begin with breaking news. It is a sign of the times we're in right now. Just the hint of a possible Ebola case has led to a flurry of activity this morning in our area. Let's point out right from the start, the health department says the person who was recently traveling to Africa does not have any Ebola symptoms. We are told this person was staying at the Four Seasons in Palm Beach. This morning, the staff said the guest complained of having difficulty with walking, and they called the paramedics. The person was taken to JFK Hospital, where that facility was put on lockdown as a precaution. That's where we find News Channel 5's Jamel Lene. Jamel.
Well, all is calm here at JFK Medical Center right now, but the thought that this could have been a suspected Ebola case had several panicking. The person that was transported here, though, we are just learning, does not fit the criteria to be tested for Ebola. The health department saying that there is no threat to the county. This patient, who was staying at a hotel on Palm Beach at the Four Seasons, took a recent trip to Africa and complained of not feeling well. Now, because the patient had been to the country, rescue crews and hospital staff wore protective gear just in case. Once medical crews checked the patient out, they concluded the person did not have Ebola-like symptoms. Now, multiple sources tell us that JFK, again, briefly was on lockdown earlier this morning. That lockdown has since been lifted. We have put in calls to the hospital, so once we hear any updates, we'll be sure to pass them along on air and online. That's the latest here in the city of Atlanta's Jamel Lene, WPTV News Channel 5.
All right, Jamel, the health department has been quick to try and reassure people there's nothing to worry about in this case. For that part of the story, we want to go to News Channel 5's Megan McRoberts this afternoon. Megan.
Well, we were called out here to the Palm Beach County Health Department late this morning for a news conference about this Ebola scare. That conference has since been canceled. Health Department officials simply handing us this piece of paper, a statement that reads, there are currently no cases of Ebola in Florida. In Palm Beach County today, CDC guidelines were utilized to determine that an individual was not at risk for Ebola. That individual is receiving care at a local hospital. Of course, we are still going to be pressing the Health Department to give us some more answers as to specifically how this case was handled, what they may have learned about this case for any potential cases or any potential scares in the future. We're going to bring you any developments on this tonight here on News Channel 5. Reporting live, Megan McRoberts, WPTV News Channel 5. Also breaking this midday, health officials are alerting airline passengers who were on the same flight as a Texas nurse who was just diagnosed with this virus. The 132 passengers were on Frontier Airlines flight 1143 from Cleveland to Dallas-Fort Worth on Monday. The hospital worker was involved taking care of a man from Liberia who died of Ebola last week at Texas Health Presbyterian in Dallas. Now, the Center for Disease Control and Prevention is asking those passengers to call the health agency so they can be monitored. Our team coverage continuing now with News Channel 5's medical expert, Dr. David Soria. He is a regular here, the chief of emergency medicine at Wellington Regional Medical Center. A lot going on this afternoon. Kind of start from the beginning. Give us some insight as to the protocol with something like this.
Well, sure. I mean, the protocol has been evolving ever since. And you know what? That patient that flew into Dallas from Liberia could have happened anywhere. And the reality is at that point in time, we didn't have any cases here in the U.S. So any of us could have gotten caught ill prepared. The reality is that we've learned a lot from this case, and we've learned a lot about some of the deficiencies or insufficiencies in our protocols all along. So the good news is that I think the overwhelming majority of hospitals throughout our country, and certainly here in Palm Beach County, are now prepared and we know what to do, and we have followed very closely the CDC guidelines. So the protocol now is very simple. Anybody that comes from any of the high-risk countries in West Africa,
sure,
if they present to a hospital, to a clinic, to a physician's office with any of the symptoms that are well known to be associated with Ebola. Fever, number one, cough, cold, congestion, nausea, vomiting, diarrhea, headache, myalgias, things like that. We then will trigger the protocol, which will include isolation, personal protective equipment, and then we follow the process as well as determining and making that confirmation by a blood draw and sending that to a designated lab that can give us those answers.
Hospitals, health experts on high alert. What we've even seen in our area this morning, really just an abundance of caution. In your career, have you seen anything like this as a doctor, your medical career?
You know, we have seen these things come about, whether it was H1N1, whether it was anthrax years ago. The fact of the matter is that this one's probably the closest that we've seen, meaning we're really starting to get, not only do we have an alert to the fear and the things that we should be aware of,
Sure.
but never really came to fruition in years prior. For example, with H1N1, yes, we had a number of patients, but it never really came to a level where there were serious patients at risk for death or for severe morbidity. Here is an illness where people are actually dying, and the risk of death is 70+%. That is probably the highest alert or the biggest concern that I've ever seen with a diagnosis or a virus that has hit our homeland.
I'm sure we'll be picking your brain on this for days
No
to
question.
come. Dr. David Soria, Chief of Emergency Medicine at Wellington Regional, thank you so much
You
for
bet.
being